Good morning, everyone. Thank you for joining me today to celebrate the launch of Niagara Health's inaugural Indigenous Health Services and Reconciliation Plan. I want to acknowledge the journey thus far and our first steps, which began with the tragic passing of Heather Winterstein at our hospital. We have come a long way in ensuring that supports are in place to build and grow the Indigenous Health Services and Reconciliation team. Seeing the incredible impact they've already had on patient care and experience has been inspiring and powerful. As we launch the inaugural Indigenous Health Services Plan today, my commitment is that Niagara Health maintains its accountability to put this plan into action and to provide regular updates to the community on our progress against the plan. I am committed to continue to listen and learn more about the history and current experiences of Indigenous peoples, and also strive to improve the quality and safety of care here at Niagara Health.
Sego skana go aga. Diga yadak was on cats ho hondo. Gali wadegwe nuala ganiki hage ne what gonna polado. We offer up this gratitude for us being able to be here today. And as Haudenosaunee, I am Mohawk Turtle Clan, and one of the things that we're asked when we come together is to offer these words on behalf of everyone to be able to move forward in a good way. And so we're going to acknowledge that, and I have the smudge. So we say Nyao Songo and Diso as we bring our minds together and offer that gratitude that each and every one of us is here today. And we recognize that we were all given these special gifts when we came into this place. Creator provided these for us along for our journey. But then he put an extra special one in each one of us. And so sometimes it takes us a while to figure out what that's all about. But when we come together and recognize those gifts, we recognize that energy that each and everyone carries.
It's really awesome to be here, and just the smudge and hearing from Jackie and Cheyenne, like I feel like I'm home whenever I am in this space. And so it feels really great to be in a hospital and to be able to smudge and have those traditional practices.
The development of this plan has been a collective process driven by community engagement, ensuring that that the voice and the perspectives of the Indigenous leaders, community members, and organizations are heard and integrated in this plan.
So I'm going to just take a few moments and highlight how the Indigenous Health Services Plan falls under each of the components of our strategic plan. So putting people first. Partnerships are a key success factor of this plan. We are already in discussions to establish a formal partnership with the Indigenous Primary Healthcare Council, ensuring that Indigenous perspectives and priorities are integrated into our healthcare services. Niagara Health intends to deepen our relationships with the Mississauga of the Credit First Nation and Six Nations Health, ensuring that our services are attuned to the specific needs and cultural contexts of these communities. Our goal is to establish a safe and welcoming space tailored to Indigenous needs, such as healing gardens and Indigenous wellness rooms. We are well underway in building a specialized team, thanks to Charity's leadership, dedicated to ensuring that Indigenous patients receive care that is culturally responsive and respectful. We will collaborate with Indigenous patient partners, allowing us to incorporate their perspectives into our service design and delivery, with the intention of nurturing a sense of belonging and trust with the Indigenous community. To ensure we deliver care that respects and honors Indigenous identities and cultural practices, we are equipping our staff with cultural safety training, ensuring that they possess the necessary knowledge and skill to do their best work. We will recruit Indigenous staff, physicians, and volunteers to strengthen our organization's cultural competency. We will engage in regional initiatives aimed at addressing racism within healthcare to demonstrate our commitment to promoting equity for Indigenous peoples. Under delivering safe and quality care, Niagara Health will deliver safe and quality care by supporting the Indigenous community within the hospital, creating Indigenous community-led programming, and improving community partnerships that enhance care. We are implementing strategies to educate and support the emergency department and hospital staff by adding resources and banners in the ED to ensure staff continue to provide compassionate care with appropriate cultural supports for Indigenous patients. We will connect Indigenous seniors and palliative care patients to the Indigenous Health Services and Reconciliation team while respecting and honoring Indigenous cultural practices during times of vulnerability and transition. We will educate staff about traditional practices during the time of birth and spread awareness about the ongoing impact of Indigenous child welfare and family protection services. With support from the community, we'll provide Indigenous-led healing circles and traditional medicines for spiritual and emotional support, aligning with Indigenous holistic approaches to healing and well-being. We will create pathways to support transitions out of the hospital by facilitating access to community resources, promoting holistic well-being beyond our hospital walls. We will increase access to traditional mental health and addictions programs and services within the hospital by addressing the unique needs of Indigenous individuals and their families. Niagara Health will continue to support and develop relationships with the Niagara Ontario Health Team partners to enable us to collaboratively and effectively leverage our collective resources. And finally, transforming how we work. Niagara Health is committed to promoting a healthcare environment that is culturally safe, invests in future generations, and builds sustainability and trust through transparent and accountable practices. By establishing policies such as the Indigenous Ceremonial Practice Policy and implementing practices like talking circles and access to elders and traditional knowledge keepers, we ensure that our care environment is culturally safe and respectful of Indigenous traditions and beliefs. By collecting data on race and Indigenous identity, informed by the First Nations principles of ownership, control, access, and possession, we can better understand and address the unique healthcare needs of Indigenous populations, thereby enhancing the quality and effectiveness of the care we provide. Niagara Health will continue to seek out opportunities for social procurement by seeking partnerships with Indigenous organizations and commit to purchasing from Indigenous suppliers. We strive to partner with academic organizations to build healthcare capacity and skills by collaborating with them, such as Six Nations Polytech, to invest in building healthcare capacity and skills among Indigenous students and learners, empowering future generations of Indigenous healthcare professionals. We will maintain collaboration with the Indigenous Advisory Committee for the South Niagara Hospital, that is our new hospital that will be opening in 2028, and broaden involvement across Niagara Health committees to ensure that Indigenous perspectives are integrated into decision-making processes and organizational governance. Niagara Health is committed to improving the patient relations process for Indigenous patients and families by ensuring it is person-centered while integrating holistic approaches and sensitivity to the needs of Indigenous patients and their families.
Don't take remissions.